Deep within the intricate network of our brains, there exists a type of cell called an astrocyte. These star-shaped cells play a vital role in supporting and protecting our brain cells, ensuring the smooth functioning of our nervous system. However, when these very cells turn rogue, they can give rise to a formidable foe, astrocytomas. Astrocytomas are a type of tumor that originates from astrocytes. These tumors are part of a larger group of brain tumors known as gliomas, which arise from glial cells, the support cells of the brain. Astrocytomas can develop in various parts of the brain and spinal cord, each location presenting unique challenges in terms of diagnosis and treatment. The impact of an astrocytoma diagnosis can be profound, affecting not only the patient but also their loved ones. Understanding the nature of these tumors, their classification, and the available treatment options is paramount in navigating this challenging journey. In the following sections, we will delve deeper into the world of astrocytomas, shedding light on their different types, the symptoms they manifest, and the multifaceted approaches to diagnosis and treatment. Astrocytomas are not a monolithic entity. They exist on a spectrum of severity, classified into 4 grades based on their growth rate and how likely they are to spread to surrounding brain tissue. This grading system helps doctors determine the appropriate course of treatment and provides valuable insights into the potential prognosis. At one end of the spectrum lies grade 1, also known as pilocytic astrocytoma. These tumors are typically slow-growing and often found in children and young adults. They tend to have well-defined borders, making them potentially curable with surgery alone. Moving up the scale, we encounter grade 2, or diffuse astrocytoma. These tumors, while still considered low-grade, tend to infiltrate surrounding brain tissue, making complete surgical removal more challenging. They are more common in adults and may require additional treatments like radiation or chemotherapy. Grade 3, or anaplastic astrocytoma, represents a more aggressive form of the disease. These tumors grow at a faster rate and are more likely to spread to nearby areas of the brain. Treatment often involves a combination of surgery, radiation, and chemotherapy. At the most aggressive end of the spectrum lies grade 4, also known as glioblastoma. This is the most common and most aggressive type of primary brain tumor in adults. Glioblastomas grow rapidly, invade surrounding brain tissue, and are associated with a poor prognosis. Despite aggressive treatment, the life expectancy for patients with glioblastoma remains limited. Understanding the grade of an astrocytoma is crucial in guiding treatment decisions and setting realistic expectations. The human brain is a complex and delicate organ, and any disruption to its normal functioning can manifest in a myriad of ways. Astrocytomas, depending on their size, location, and growth rate, can produce a wide range of symptoms, often mimicking other, less serious conditions. Headaches are among the most common symptoms of astrocytomas. However, not all headaches are created equal. Headaches associated with brain tumors tend to be persistent, worse in the morning, and may worsen with coughing, sneezing, or changes in position. Seizures, characterized by abnormal electrical activity in the brain, can also be a presenting symptom, particularly in low-grade astrocytomas. These seizures may manifest as convulsions, loss of consciousness, or subtle changes in behavior or awareness. Vision changes, such as blurred vision, double vision, or loss of peripheral vision, can occur if the tumor is located near the optic nerves or the visual processing centers of the brain. Similarly, speech difficulties, including slurred speech, difficulty finding words, or difficulty understanding language, can arise from tumors affecting the language centers of the brain. Weakness or numbness on one side of the body, resembling a stroke, can also be a symptom of an astrocytoma. This occurs when the tumor affects the motor or sensory pathways in the brain. It's important to remember that these symptoms are not exclusive to astrocytomas and can be caused by various other conditions. However, experiencing any of these symptoms, especially if they are persistent or worsening, warrants prompt medical attention. Early detection and diagnosis are crucial in improving treatment outcomes and potentially increasing survival rates. Diagnosing an astrocytoma is a multi-step process that typically begins with a thorough neurological examination. This examination assesses various aspects of brain function, including reflexes, coordination, vision, and mental status. If a brain tumor is suspected, further investigations are warranted. Magnetic resonance imaging, or MRI, is the gold standard imaging technique for diagnosing brain tumors. MRI uses a strong magnetic field and radio waves to create detailed images of the brain and spinal cord. It can reveal the size, location, and sometimes the grade of the tumor. Computed tomography, or CT scans, also known as CAT scans, are another imaging modality used to diagnose brain tumors. While not as sensitive as MRI in detecting subtle abnormalities, kinetic scans are widely available and can provide valuable information about the tumor's density and its relationship to surrounding structures. While imaging techniques can provide valuable insights into the tumor's characteristics, a definitive diagnosis of an astrocytoma requires a biopsy. This procedure involves surgically removing a small sample of the tumor tissue, which is then examined under a microscope by a neuropathologist. The biopsy sample allows for a precise diagnosis of the tumor type and grade, guiding treatment decisions and providing valuable prognostic information. The biopsy can be performed during surgery to remove the tumor or as a separate procedure. The diagnosis of an astrocytoma can be a life-altering event. However, understanding the diagnostic process and the information it provides can empower patients and their families to make informed decisions about their care. Treating astrocytomas is not a one-size-fits-all approach. The specific treatment plan for each patient is tailored based on a multitude of factors, including the tumor's grade, size, location, the patient's age and overall health, and their individual preferences. Surgery is often the first line of treatment for astrocytomas, especially for tumors that are accessible and have well-defined borders. The goal of surgery is to remove as much of the tumor as possible without causing damage to surrounding brain tissue. However, complete removal may not always be achievable, particularly for tumors that have infiltrated surrounding areas. Radiation therapy utilizes high-energy rays to target and destroy cancer cells. It can be delivered externally using a machine outside the body or internally using implants placed near the tumor site. Radiation therapy is often used after surgery to kill any remaining cancer cells or as a primary treatment option for tumors that cannot be surgically removed. Chemotherapy involves using drugs to kill cancer cells or stop them from dividing and multiplying. It can be administered orally, intravenously, or directly into the cerebrospinal fluid that bathes the brain and spinal cord. Chemotherapy is often used in conjunction with surgery and radiation therapy, or as a palliative measure to slow tumor growth and alleviate symptoms. In recent years, targeted therapies have emerged as a promising treatment modality for certain types of astrocytomas. These therapies work by targeting specific molecules or pathways involved in cancer cell growth and survival. Examples include monoclonal antibodies and small molecule inhibitors. The treatment journey for astrocytoma can be long and arduous, often involving a combination of therapies. The prognosis for astrocytoma varies widely depending on several factors, the most important being the tumor grade. The grade reflects the tumor's aggressiveness and its tendency to spread. Low-grade astrocytomas, such as pilocytic astrocytoma, which is grade 1, and diffuse astrocytoma, which is grade 2, generally have a better prognosis than high-grade tumors. With appropriate treatment, some patients with low-grade astrocytomas can achieve long-term remission or even be cured. However, these tumors can recur, requiring ongoing monitoring and potential further treatment. High-grade astrocytomas, including anaplastic astrocytoma, which is grade 3, and glioblastoma, which is grade 4, are associated with a poorer prognosis. These tumors grow and spread rapidly, making complete eradication challenging. While treatment can help slow tumor growth and alleviate symptoms, survival rates for high-grade astrocytomas remain significantly lower than for low-grade tumors. Other factors that can influence prognosis include the tumor's size and location, the patient's age and overall health, and their response to treatment. Tumors located in critical areas of the brain or those that are large and difficult to remove surgically tend to have a poorer prognosis. Younger patients and those in good overall health often have better outcomes than older patients or those with underlying health conditions. It's important to remember that prognosis is not destiny. While the fight against astrocytoma remains a formidable challenge, the landscape of treatment is constantly evolving, offering renewed hope for patients and their families. Researchers and clinicians worldwide are relentlessly working to develop new and innovative therapies that target these tumors more effectively while minimizing side effects. One area of active research is immunotherapy, which harnesses the power of the body's own immune system to fight cancer. Immunotherapy drugs, such as checkpoint inhibitors and CAR T-cell therapy, are showing promise in boosting the immune system's ability to recognize and destroy cancer cells. Clinical trials are underway to evaluate the safety and efficacy of these therapies in patients with astrocytoma. Another promising avenue is targeted therapy, which focuses on exploiting specific vulnerabilities in cancer cells. Researchers are identifying molecular targets that drive the growth and survival of astrocytoma cells, paving the way for the development of drugs that can precisely target these vulnerabilities. Targeted therapies offer the potential for more effective treatment with fewer side effects compared to traditional chemotherapy. Advancements in surgical techniques and radiation therapy are also contributing to improved outcomes for patients with astrocytoma. Minimally invasive surgical approaches, such as laser ablation and focused ultrasound, are allowing surgeons to access and treat tumors in delicate areas of the brain with greater precision and minimal damage to surrounding healthy tissue. The field of neuro-oncology is rapidly advancing, driven by a collaborative effort among researchers, clinicians, and patient advocates. Section 8. The role of clinical trials, advancing treatment options. Clinical trials are a cornerstone of progress in the fight against astrocytoma. These carefully designed research studies play a crucial role in evaluating the safety and effectiveness of new treatments and therapies. By participating in clinical trials, patients not only contribute to advancing medical knowledge, but also gain access to cutting-edge treatments not yet widely available. Clinical trials for astrocytoma encompass a wide range of approaches, including new drugs, novel combinations of existing therapies, innovative surgical techniques, and advanced radiation therapy protocols. Each trial has specific eligibility criteria to ensure the safety of participants and the scientific integrity of the study. Patients interested in exploring clinical trial options should discuss their eligibility with their healthcare team. The decision to participate in a clinical trial is a personal one, and patients should carefully weigh the potential risks and benefits in consultation with their loved ones and medical providers. Clinical trials provide a critical platform for testing and validating new treatments, ultimately leading to improved outcomes for patients with astrocytoma. By participating in these trials, patients become active partners in the quest for a cure. Section 9. Living with an astrocytoma support and resources. Receiving an astrocytoma diagnosis can be overwhelming, not only for the patient but also for their loved ones. Navigating the complexities of treatment, managing side effects, and coping with the emotional and psychological impact of the disease requires a strong support system. Patients and their families are encouraged to communicate openly with their healthcare team, asking questions, expressing concerns, and seeking clarification about their diagnosis, treatment options, and prognosis. Building a strong rapport with healthcare providers can empower patients to make informed decisions about their care and feel supported throughout their journey. Support groups and online communities provide a valuable platform for patients and caregivers to connect with others who understand the challenges they face. Sharing experiences, exchanging information, and offering emotional support can help alleviate feelings of isolation and provide a sense of hope. Many organizations dedicated to brain tumor research and advocacy offer a wealth of resources for patients and families. These resources may include financial assistance, transportation services, counseling services, and information about clinical trials. Living with an astrocytoma can be challenging, but it's essential to remember that you are not alone. Section 10. The importance of research funding the future. Research is the lifeblood of progress in the fight against astrocytoma. Every breakthrough, every new treatment, every glimmer of hope stems from the tireless efforts of researchers dedicated to unraveling the complexities of this disease. Funding for brain tumor research is crucial to support ongoing studies, attract talented scientists to the field, and accelerate the development of new and innovative therapies. Government agencies, private foundations, and individual donors play a vital role in ensuring that research efforts continue to thrive. Public awareness and advocacy are also essential in driving research funding and policy changes that benefit patients with astrocytoma. By raising our voices collectively, we can increase funding for research, improve access to care, and ultimately find a cure for this devastating disease. Supporting brain tumor research is an investment in the future, a future where astrocytoma is no longer a life-limiting diagnosis, but a manageable condition. Section 11. Conclusion, a message of hope and progress. The journey with astrocytoma is undoubtedly challenging, filled with uncertainties, setbacks, and triumphs. While the diagnosis can be daunting, it's important to remember that progress is being made every day. Advances in research are leading to new and more effective treatments, offering renewed hope for patients and their families. Clinical trials are paving the way for groundbreaking therapies, and support networks are there to provide guidance and encouragement every step of the way. While there is still much work to be done, the unwavering dedication of researchers, clinicians, and patient advocates is a testament to the unyielding spirit of human ingenuity and compassion. Together, we can continue to push the boundaries of scientific discovery, improve patient outcomes, and ultimately find a cure for astrocytoma. This is a journey that requires courage, resilience, and an unwavering belief in the power of hope. By standing together, supporting research, and advocating for better treatments, we can create a future where astrocytoma is no longer a source of fear, but a testament to the indomitable human spirit.